For many people, the first few weeks adapting to positive airway pressure are the most challenging. So I asked our panel of OSA patients to share their experiences. I'd like to thank all of you for coming today and sharing your experiences about OSA and CPAP therapy. We'd like to welcome Lanita and Dave Myers, Raul Guevara, Dr. Matthew Abraham, Peggy Jennings, and Dee Stanley. Is there anything that you wish you knew before you got your treatment that you think would have made your transition easier?
Well, I think it was just initially with the whole idea of thinking that I might have it, but once I learned more about it and realized that all the diseases that could be caused because of it, I looked at the big picture, and there really wasn't too much to really adjust to or overcome. And on top of that, I was getting a great night's sleep. So it was a pretty easy transition, not much to overcome.
Once I started acclimating and getting better with the treatment, the benefits were significant. And it really made a significant improvement in my life.
Some people adapt quicker than others, but I think that's one thing. If you just think about it, that you woke up and it's on the floor, that's not necessarily mean you can't wear the therapy. It means pick it up, put it back on, and as we'll say, you know, Matt uses the word, we tend to use it all the time, acclimate. You got to acclimate to therapy.
I was concerned only in the sense of a machine coming to the house. Machine makes it appear noisy. Okay, and that was not the case. The machine is actually, it is a hum, and it's white noise. And I am a very light sleeper, as I mentioned before, and it was very easy to adapt to.
What were some of the issues that you faced, and how did you address them?
Had some problems initially as far as getting congested, and I went to some humidity that way. And where we live in the East Coast, you tend to, wintertime, you might need a little more moisture than you do in the summertime. In summertime, we do get some nice humidity, and I can go without adding the heat or even the humidifier sometimes.
In his first few weeks of therapy, he would go to sleep with it on, and 3 o'clock, 4 o'clock in the morning, he'd rip it off. It would be laying on the floor.
Sure.
And within about an hour, everything started back up again, the snoring started back up again, so I would be waking him up and telling him to put his machine back on. Because then I would wake up.
I am a flipper. I flip, I never lay one position. I'm flipping all night long. And I cannot imagine how in the world am I going to have this mask on with the tube, a hose going one place, the machine is another place. I said, the machine will be in the bed with me. The hose will be probably at the foot of the bed. Well, I was so wrong. I can flip, flop every way I want with the machine, with the mask, with everything. Nothing moves but me.
It was going into like about 2 to 3 weeks of using the CPAP, and I started snoring again. So it bumped up to a 10, and you could tell the difference right away. Going from a 9 to 10, there was a significant difference, and I felt that much better once it really kicked in and I was using it at a 10.
Sinus infections are a common problem that occur throughout society, and this is something that can actually affect the way we tolerate our treatment. And it's actually important sometimes to treat those infections to allow you to use the equipment easier. Now, one of the catches about this, which is neat, is that if you use the heated humidified air on the CPAP, well, that can actually sometimes alleviate the symptoms in itself, because the moisturized air can decrease some of the inflammation in the processes.
I mean, I cannot literally remember the last time I had a cold or a sinus infection or a sinus headache, or I think it's because I'm breathing in that contained environment. It's great.
For the person that has it, think of the outcome, think of the result. All right, don't think of the nuisance, the minor irritations, the problems. Think about what disease could you be fortunate enough to be diagnosed with that all I have to do is at night put a mask on my face. Okay, it's not something I got to take significant medication. It's not something that I have to worry about dying from if I wear my therapy. This can not only make your life come back, it can prevent you from having a difficult life down the road. So the issue is focus on results. I mean, don't sit there and let, oh, my mask, or I got a red mark, or my nose is dry, or you know, I'm afraid to wear that in front of my spouse. Those are all excuses. Think of what it's going to do for the rest of your life.
I want to thank all of you for joining us. I'm sure all of your experiences will help people who have recently been diagnosed make a smoother transition to therapy. That concludes this edition of Inside OSA. As we've seen, learning to regularly use positive airway pressure therapy requires commitment. And as with any therapy, people respond differently. Some have difficulty with side effects. John, you'll be addressing this in the next series, won't you?
Yes, Sherry. We will explore strategies to address therapy's side effects. When you look at the big picture, however, the side effects pale when compared to stroke, cardiovascular disease, automobile accidents, and other life-threatening consequences of untreated OSA.
So please join us for the next edition of Inside OSA. Thanks again for watching.